Ever get one of those toothaches that just makes you want to crawl into a hole and disappear?
Can't say I have, but I can definitely see how it'd get that bad.
Seriously. Well, today we're tackling a topic that's way more intense than your average toothache. We're going deep on tooth infections and why what seems like a minor annoyance can actually turn into a life or death situation.
It's true. These things can get out of hand surprisingly fast.
So before we get into all the scary stuff, let's start with the basics. What exactly is a tooth infection?
Well, at the core of it, it's all about bacteria. They find their way into your tooth, usually through a crack or a cavity, and start multiplying in the pulp.
The pulp. That sounds unpleasant.
Yeah, not the best place to have a bacterial rave. See, the pulp is that soft inner part of your tooth where the nerves and blood vessels hang out. Very sensitive, very important.
Okay, got it. So the bacteria set up shop in the pulp, and then what? What makes it an actual infection?
Well, as they multiply, they cause inflammation, which leads to a buildup of pressure inside your tooth.
Hence the toothache from hell.
Exactly. That throbbing pain is your body trying to tell you something's wrong. But it doesn't stop there. You might also notice some swelling, maybe even some redness in the gums around the tooth. And if things get really bad, you could even have a fever or some weird stuff happening like changes in your urine.
Okay, that's officially way past minor annoyance territory. Sounds like those symptoms are a sign that things are escalating quickly.
They definitely can. And that's where the real danger comes in, because those bacteria, they're not content to just hang out in your tooth forever. They can actually break free and start exploring other parts of your body.
Welcome back. Now, before the break, we were talking about how a tooth infection isn't always content to just stay put.
Right, it can spread. And when it does, things can get pretty scary.
So let's talk about that spreading. Our source mentions the brain as a potential target, which honestly kind of freaked me out a little bit.
Yeah, it's not something you want to think about too much, but it is a very real danger.
Okay, so how is that even possible? Like, how do bacteria in your tooth even get to your brain?
Well, your bloodstream, think of your blood vessels as like these tiny little highways that run throughout your entire body.
And bacteria can just hop on or off as they please.
Pretty much, yeah. And since your mouth has a direct connection to your bloodstream, well, it's not that far of a trip for those bacteria to make their way up to the brain.
Okay, so let's say those bacteria do reach the brain. What happens then?
Well, you could end up with something called a brain abscess. Basically, it's a pocket of pus that forms in your brain tissue.
That sounds not good.
Definitely not. And the symptoms are pretty alarming. And severe headaches, high fever, you might even experience neurological problems like seizures or vision changes.
So just a casual walk in the park for your brain then, right?
Definitely not. This is serious stuff, and it's not something you want to wait out and see what happens.
That's for sure.
Mm.
And then on top of a brain abscess, our source also mentioned something called cavernous sinus thrombosis. Have you ever even heard of that before? I know I haven't.
I have. It's not a fun one.
Tell me more. What is this thing, and how does it connect to a tooth infection?
So you know that area behind your eyes and nose where your sinuses are? Well, right near there is a major blood vessel called the cavernous sinus, and it's responsible for draining blood from your brain and face. Now, when you have a tooth infection that spreads, it can sometimes cause a blood clot to form in this sinus, blocking blood flow.
A blood clot in your brain? Are you serious?
Yeah, and that blockage can lead to a stroke.
A stroke from a toothache? This is blowing my mind right now.
It's crazy, I know. But it just goes to show how serious a seemingly simple tooth infection can become if it's ignored. And it doesn't stop there. Our source also talks about the infection spreading to the mediastinum, which is another area most people probably haven't heard of.
Yeah, the mediastinum. What is that again? Remind me.
It's that space in the middle of your chest, between your lungs. It basically houses all the important stuff. Your heart, your esophagus, major blood vessels, the trachea. It's like the VIP section of your chest.
So kind of important then.
Understatement of the year. And if a tooth infection gets in there, it can cause something called mediastinitis, which is a very serious inflammation of that whole area. We're talking chest pain, difficulty breathing, fever. Your body is waging a full-on war against that infection, and it's happening right in the heart of your chest.
Okay, you've made your point. Tooth infections are no joke. But on a more positive note, I'm pretty sure our source also talks about ways to prevent these things.
Right.
And we're back. So after that rather terrifying trip through the potential consequences of an untreated tooth infection, I'm really hoping we can end on a more positive note.
Absolutely.
Yeah.
And luckily we can. Our source has a whole section on prevention, which is great news because it means we have some control over this.
That is good news.
Yeah.
So give it to me straight. What are the essentials for keeping those little bacterial monsters away from my teeth?
Well, you're not going to like this, but it all starts with good old-fashioned brushing and flossing.
Come on, you're telling me there's no magic pill or anything?
I wish, but honestly, those two things, they're like 80% of the battle right there.
Okay, fine. But just to be clear, when we say brushing, we're talking like twice a day,
Yeah.
right? And actually getting all the surfaces, not just a quick swipe.
You got it. Twice a day for at least 2 minutes each time. And using a fluoride toothpaste is important too.
Fluoride,
Yeah.
because
Fluoride actually helps to strengthen your enamel, which makes it much harder for those bacteria to break through and cause a ruckus.
so it's like putting extra armor on your teeth. I like
Yeah,
it.
exactly. And flossing. Well, that's all about getting those little bits of food out from between your teeth where your toothbrush can't reach. Those little
Yeah.
bits, they're like an all-you-can-eat buffet for bacteria. We got to cut off their food supply.
Makes sense.
Mm-hmm.
All right, so brushing, flossing. What else?
Regular dental checkups. I cannot stress this enough.
Yeah. Go to the dentist. I've heard it all before. Hear me out. I know it's not always the most fun activity, but it is crucial. Because even with the best brushing and flossing in the world, sometimes you just miss stuff or things happen that are out of your control. And your dentist. They can catch those early signs of trouble, a tiny cavity, some gum disease, whatever, before it blows up into a full-blown infection. Okay, that makes sense. Early detection is key, right? 100%. Because if you catch a tooth infection early enough, it's usually a pretty straightforward fix. A round of antibiotics, maybe a filling, and you're good to go. But if you wait until it's spread, then we're talking about a whole different ballgame. Root canals, surgery, possibly even hospitalization. Not fun.
Definitely not fun. Well, I think that about covers it for today's deep dive into the terrifying but thankfully preventable world of tooth infections. Any last words of wisdom you want to leave our listeners with? Just that. Take care of your teeth, folks. It seems like a small thing, but it can really make a world of difference in your overall health and well-being.
Couldn't agree more. And with that, we'll say goodbye for now. Until next time, stay curious and keep those pearly whites sparkling.